How to treat and cure hiatal hernia. Hiatal hernia. Hiatal hernia is a condition in which the upper portion of the stomach protrudes into the chest cavity through an opening of the diaphragm called the esophageal hiatus. This opening usually is only large enough to accommodate the esophagus. With weakening and enlargement, however, the opening, or herniation, can allow upward passage, herniation, or even entrapment of the upper stomach above the diaphragm. Hiatal hernia is a common condition. By age 60, up to 60% of people have it to some degree. There are two types of hiatal hernia. The sliding type, as its name implies, occurs when the junction between the stomach and esophagus slides up through the esophageal hiatus during moments of increased pressure in the abdominal cavity. When the pressure is relieved, the stomach falls back down with gravity to its normal position. The fixed type, or paraesophageal, implies that there is no sliding up and down. A portion of the stomach remains stuck in the chest cavity. Hiatal hernia causes. Suspected causes or contributing factors: obesity, poor seated posture, such as slouching, frequent coughing, straining with constipation, frequent bending over or heavy lifting, heredity, smoking, congenital defects. Hiatal hernia symptoms. Symptoms can include chest pain or pressure, heartburn, difficulty swallowing, coughing, belching, hiccups, pain. At times, a hiatal hernia causes chest pain or upper abdominal pain when the stomach becomes trapped above the diaphragm through the narrow esophageal hiatus. Other causes: rarely, with a fixed hiatal hernia, the blood supply is cut off to the trapped portion of the stomach, causing great pain and serious illness. This is called a strangulated hiatal hernia, and it is a true medical emergency. Hiatal hernia also causes symptoms of discomfort when it is associated with a condition called gastroesophageal reflux disease, commonly called GERD. This condition is characterized by regurgitation of stomach acids and digestive enzymes into the esophagus through a weakened sphincter that is supposed to act as a one-way valve between the esophagus and stomach. Hiatal hernia is thought to contribute to the weakening of this sphincter muscle. Although it is true that hiatal hernia or GERD can cause chest pain similar to angina, or heart pain, including chest pressure that can radiate to the arm or neck, do not assume that such pain is caused by the less serious condition of the two. When in doubt, it is safer to be seen by a doctor immediately in order to rule out more serious problems first. Seek medical care for hiatal hernia. When the symptoms of hiatal hernia are new, persistent, won't go away, or severe. When it is not clear what is causing your symptoms. When to go to the hospital. When you have chest pressure or pain, especially if you have known heart disease or these coronary risk factors: diabetes, smoking, high cholesterol, high blood pressure, older than 55 years, male gender, or family history of early heart attacks or angina. Vomiting blood. Dark, tarry stools. Palpitations, feel heart beating in your chest, or feeling faint. Cough and fever. Shortness of breath. Inability to swallow solid food or liquids easily. Hiatal hernia exams and tests. The first visit for the symptoms of hiatal hernia may warrant tests to rule out more serious or life-threatening causes first, such as heart disease. A thorough history will be taken to determine associated symptoms, circumstances, and risk factors for various diseases. Tell the doctor about foods or activities that help or worsen the symptoms. A complete physical exam will focus on the digestive, pulmonary, lungs, and cardiovascular, heart, systems. A rectal exam and stool test for blood may be necessary to determine if there is bleeding from the digestive tract. Initial tests. Electrocardiogram, ECG, to look for electrical disturbances of the heart from disease. Chest X-ray to look for pneumonia, collapsed lung, or other problems in the chest. Blood tests to look for anemia, infection, or injury to the heart, pancreas, or liver. Other tests focusing on the cardiovascular and pulmonary organ systems if suspicion remains high for problems in these areas. Possible follow-up tests. Barium swallow or upper GI X-ray series may be performed by a radiologist. You drinks some contrast material, and X-rays are taken. Endoscopy may be performed by a gastroenterologist. A long fiber optic scope is passed through the mouth and into the stomach looking for an ulcer, tumor, or other tissue damage. Sometimes a biopsy is needed. Self-care for hiatal hernia. Lifestyle changes are often necessary to avoid symptoms of hiatal hernia. Modify your activities. Minimize heavy lifting, straining, bending over. Improve seated posture, don't slouch. Exercise more. Lose weight. Sleep on an incline, with head of bed raised 4-6 inches on blocks. Choose standing activities after a meal rather than sitting or reclining. Modify your diet. Avoid the following: caffeine, chocolate, fried or fatty foods, peppermint, alcohol. Meals within 2-3 hours of bedtime. Large meals, eat smaller meals more frequently. Try over-the-counter remedies. Check with your doctor or pharmacist first if you are taking other medications, are pregnant, or have other medical conditions, before starting therapy at home. Medical treatment for hiatal hernia. Surgical treatments rarely are necessary except when emergency exists, such as a strangulated hiatal hernia or aggressive conservative therapy has failed. Some people don't respond to home care or medical treatment and seek the advice of a general surgeon or thoracic surgeon about the latest options. Various techniques have been tried to fix the defects of hiatal hernia with some success. Hiatal hernia follow-up. Follow the treatment plan you and your doctor discuss. Keep appointments for further tests or exams. Start the necessary lifestyle changes. Hiatal hernia prevention. Lose weight, if overweight. Avoid excessive straining, bending, and slouching. Try the other lifestyle changes suggested under self-care. Hiatal hernia outlook. If treated appropriately and lifestyle changes are made, you can minimize the effects of a hiatal hernia. If left untreated, complications can arise such as a strangulated hiatal hernia. For hiatal hernia associated with GERD, complications can include bleeding, perforation of the esophagus, and a greatly increased risk for esophageal cancer.